Hello, I'm Dr. Thomas. I'm going to explain and demonstrate a new kind of biofeedback called hemoencephalography. This is a biofeedback that trains the patient to enhance their frontal lobe cerebral blood flow. Now here we have an infrared camera, in fact two little cameras that fit right onto the head like this, a little kind of cap. And in fact I'll put it on right now. And it reads the cerebral blood flow, or the temperature actually, of the person's front of their head to the 100th of a degree. And as the feedback is as the the temperature is recorded, it's fed into the computer, and the person can train their own cerebral blood flow to increase. Now what's so unique about this system of biofeedback is that the feedback signal is transformed into any DVD you would like to watch. And in this case, we're going to watch the animation The Incredibles. And what you do is you put in the DVD into the external drive. And you boot up the software. And now, what happens is this. The temperature of the anterior cingulate gyrus in the front part of your brain fluctuates naturally over time. And this software is on auto threshold so that it chases your own temperature. Eventually, you'll have a situation where the person's temperature is below the threshold. And then the movie stops. And with focus on a certain part of the computer, the focus will bring up the temperature to the 100th of a degree, so that their temperature will increase and then the movie will continue. So let's see if we can show how to do this. We're starting the movie now. And what we'll do is have the person just pay attention to the movie. That's all they need to do. Is they just pay attention to the movie. And so here's the movie, it's starting. And we'll get onto a certain chapter of this watching a movie.
Hey, it's a nice going on. You're very late. How do I look? Good.
The person, all they have to do is be paying attention to the movie. The movie's going. Now we'll turn on the biofeedback condition.
Will you have this woman to be your lawful wedded wife?
And in this case, the temperature of the patient's brain is below the threshold. You focus on a certain part of the computer. The focus is bringing up the temperature. Relaxed, focus. Good. Good. To the threshold. Good. You can change the difficulty of it if you want. Then the movie continues when the temperature is brought up. What you're essentially doing is training the person to control their own frontal lobe temperature. And as a result, what happens is that the person gains control over their temperature, triggers off the frontal lobe homeostatic mechanisms, or biological properties, that control the entire brain. That's essentially what you're doing. So I'm going to turn down the temperature, the volume. And so I can talk and you don't listen to The Incredibles. Now, what happens over time is a person gets good at controlling their own frontal lobe temperature, and this sends healing kind of mechanisms that appears to help the following kinds of patients, particularly migraine headaches, traumatic brain injury, attention deficit disorder, and bipolar disorder. the results tend to be permanent. Patients I've had with migraines, in 8 sessions I've gotten them off of their medications, and a year and a half later they're not back on them. They've gotten off this very difficult migraine medication, which, if you know what migraine medications are, you know they're difficult kinds of things to take in, and there are real problems with it. Neurologists and pain doctors admit this directly. And you do this for about 20 minutes or 30 minutes, and after about 8 or 10 sessions you can see some results. With attention deficit disorder, make 20 or 30 sessions might be required. With bipolar disorder, you might have to do about 20-30 sessions, then once a month thereafter. So it's a good and effective treatment, and it will probably be a mainstay in future treatments. So there we are with hemoencephalography.